Healthcare is a large and growing industry. Some would say it has become too big and unwieldy. It has its own language, its own rules, and patients usually have to find their own path through this maze. There's no help desk or guide to show patients the way.
Over time, we have had healthcare turn into more of a traditional business where we've forgotten what the patient's needs are as we set up our business procedures and policies. So they're sort of left out of the equation just very gradually and slowly over time.
Recently, a new philosophy towards healthcare has begun to emerge. In this idea, a team of health professionals works together, coordinated by a patient's primary care provider. They collaborate as a unit to provide high levels of care, ready access to services, communications, coordination and integration, while constantly assessing quality and safety. This new approach is called the patient-centered medical home.
Patient-centered medical home is about building relationships between patients and their primary care providers, that they have a place they can go to where all of their care is coordinated for them and the patient isn't having to navigate the healthcare system on their own.
What it means for our patients is that they come here and we are their first stop for everything. And we hope that for 90% of the things that they come to us with, that we're their last stop and we can help them, cure them, provide all the information that they need.
When you're comfortable with a provider, you feel comfortable sharing things that are bothering you, things that you are afraid of. And those conversations just don't happen when you don't know the person you're talking to.
For us, a medical home means that the patient trusts us and sees us as the place that they want to come to for their medical consult.
Clinica's ideal patient-centered medical home has 6 key components: continuity, access, team care, delivery models, information systems, and patient activation. Let's look at how each segment works in Clinica's healthcare system.
All healing occurs in the context of relationships. Absolutely true. And I think our effectiveness in providing behavioral and psychological, mental health care is intimately tied to the fact that we have relationships with our patients and they get to know their treatment team and they get to know a primary care provider, primary care clinician.
Probably most important thing for a patient coming to Clinica is generally being able to see somebody they know and that they have confidence in, who can discuss with them what their healthcare issue is and what the options are.
They see nurses and MAs and they know who all of those staff members are.
We have a lot of strategies that we put in place over the years to try and maximize continuity. We do a lot around color branding, so we put people on a team. We call them color teams or pods. We give out provider appointment cards that are the same color. So if a patient calls and is unsure of exactly who the provider was that they saw early on in their care at Clinica, we can ask them what color's the card. We can get them to the right pod. Those things help us a lot with patients who are learning the concept of continuity. They haven't had that before.
Relationships are the most important thing about medical care. The relationship that you as a patient have with your provider, with your nurse, with your medical assistant, that's what's going to be the catalyst to helping you become a healthier patient.
Access is being able to get the health care that you need when it works for you, when it's convenient. Scheduling visits and all that sort of thing can be very challenging. And at Clinica, we don't schedule visits more than 2 weeks ahead of time. And what that creates is a lot of access. So for example, if you are my patient and your child is sick today and you call up and that person needs to be seen, there's a very good chance that I'm going to have an open visit in my schedule that day and I'll be able to see your child as their primary care physician and evaluate them acutely. When I go to my primary care physician and there's an acute issue, we never see our PCP. We see, whoever has the available slot. And I think that really helps take better care of people over time. Someone who knows them, a provider that knows them.
So the advantages of open access scheduling are that our patients actually are able to schedule the appointment for care when it's best for them. They're more apt to show up for that care as a result of that. And also, if you're sick today, you want to have care today. If you're sick today, you don't want to wait till tomorrow. So the patients are able to get the care when they need it and when they want it, which makes it easier for them to show up. One of the things that we've tracked really closely for years now is panel size. And that's really important to the provider's ability to provide care, because if their panel is too big and they actually have a demand on their schedule that is greater than what they have capacity to handle, we're not going to be providing good, efficient, timely care for our patients. So we do monitor on a quarterly basis the provider's panel size, and we can adjust providers' panels based on that report. And it helps us with scheduling. It helps us with really the ability to keep a provider's schedule in control and not have a lot of backlog.
We track something called time to the third, and that's the third next available appointment. And it's arbitrarily the third because the first next available might be a cancellation in 20 minutes, and that doesn't help me bring another patient in. And the second is kind of a wash. So when I look at time to the third, I can see how difficult it is for a particular patient to come in with their provider.
Like, for example, if my time to third was 7 days, that does not show very good access. If my time to third is today or tomorrow, that's great. I have 2 to 3 open visits over the next day or two, which is a very immediate measure of how available I am to my patients. Having good access really works for us as a team because we're able to provide more health care to more people. Our no-show rates go down. When a patient makes their visit today and they're coming in later today, they show up, they're motivated, they're activated, they're participating in their care. When they schedule out a week or 2 weeks, the no-show rate goes up. And so when we schedule close together like that, we are seeing the most number of patients in a day that we can for the providers that are available to give care.
Those are the kinds of things that put the patient first when you design, rather than just making the clinic hours what works for the healthcare organization or for Clinica or for the providers.
Access also means that patients can get various kinds of services, including acute care, procedures, pharmacy and nutritional services, mental health, and dental care.
Our patients tend to have a lot higher dental needs than the average population. By having a dental clinic within a community health center, we can reduce ER admissions, high-cost care that our patients wouldn't get otherwise. We can produce better outcomes for our patients overall. Diabetic patients are much better when they are receiving routine dental care. Pregnant patients have better prenatal outcomes when they're getting routine dental care. And then for children overall, we can prevent them from having the types of diseases that diabetics and prenatal patients have in the long run.
At Clinica, the concept around patient-centered medical home extends outside the walls of the clinic. We try to manage patients even when they're not currently coming in. We partner with other institutions such as the hospital or the emergency room or the skilled nursing facility to be able to follow up on our patients who are getting care at those other places.
On our pod structure, the patient's able to see all of us as a team, and we all work together. My role is to provide the medical knowledge that I have so that the patient can make an informed decision.
It's phenomenal, the team that I work with on a pod. A nurse, a medical assistant, behavioral health professionals, other providers, a pharmacy tech, it's medical record staff. Every moment during the day, I have got multiple people available to me to help get information I need to take better care of my patients, to help me answer questions that my patients have that I may not have the information for readily.
So the advantage of having a healthcare team that the patient knows is they can then access sometimes questions that they just need some advice from the nurse. And if they know and trust that nurse and know that that nurse is right next to their provider, they feel more comfortable in accessing care, making a phone call, getting an answer to a problem without having to utilize the services of the provider, making a visit to come in.
So the composition of the care team and the staff that are involved or are part of the care team are the medical providers, the nurse team manager, a clinic nurse, behavioral health professionals, case managers, medical records, and front desk staff as well.
We at Clinica pay a lot of attention to workflow and the things that we do in the pod. We, each member of the team work at the top of their license. For example, we want, if we have to send a letter for normal results, we have our front desk do that.
We talk about working to the top of our license or the top of our ability here, so that each person is really maximizing the skills they have. And that, for example, my skill set as a provider is different than other people in the clinic. And in the past, there would be times perhaps providers would be running around trying to make a photocopy of something for a patient. And you feel like you're providing care, your patient really needs that shot record. But if I can turn to a team member and say, this patient needs this shot record, can you do this for me? I'm back in the room, maybe having time to address another health concern that patient has. And that's really utilizing my skill set to its maximum.
If you really wanted to improve the health care of your patients, the team model probably is the best way that you can do it.
I think it's the best method for care because you actually have a team environment, and taking care of patients as a team, in my opinion, the best thing about that is the patient can get to know the medical staff that are caring for them, and they can build a relationship.
The concept around improving delivery models is that one-on-one visits work well for some patients, but there's a lot of other patients who need other ways to get their healthcare information. So we include other models such as care in groups, using a patient portal, secure email, or telephonic care to provide the care that patients need in order to keep them activated.
You can manage demand by looking at offering alternative types of care, such as group visits. You're able to see more patients with the same number of appointment slots. And you also can manage demand by looking at your seasonal fluctuation. We call that master scheduling. We know that in the summer we're slower, so we should have our patients that need well exams come in the summer instead of in the middle of cold and flu season. So those are things that you can do to help manage your demand.
The patients can access care at Clinica by one-on-one, the traditional way that we have. And then they also can access care as in a group visit. When we do like diabetes group visits, they can access care that way. Or they can also access care on the phone. They also have access to nursing care and medical care over the phone when the clinic is closed. So they can receive a 24-hour medical care if they need it.
The other thing that you can do is work with your clinic team, your care team, to be able to pull that patient in for care and have the nurse assist the provider in seeing that patient that day in the clinic. And we call them co-visits, where the nurse really does the workup for the provider, and then the provider sees the patient as well.
Recently, here at our site, we initiated a means by which patients can enter a secure website and log in and have direct communication with their healthcare team. They can request a medication refill this way. They can make requests for paperwork this way. And that gives them another means by which to communicate with the team.
Patient portals are going to be the next big thing, I think, for patients. And it's really about letting the patient self-service. So it's having the patient have the capacity to access their labs online. They'd be able to email the provider online and figure out, hey, I have a cough. Do I have to really come in and figure out what's going on with it, or can I talk to my provider to figure out what's going on? If I have a question around certain, medications, certain things that are going on, can I, again, talk to my provider on that? Other things that they can do in the portal, they might be able to request an appointment and schedule an appointment online, so they wouldn't have to utilize our call centers. So there's a lot of really great opportunities coming down the line with utilizing patient portal sites. When we collect our data, we collect the data at a provider level, at the team level, and ultimately at the organization level. The purpose of that is we can absolutely compare our outcomes provider to provider, team to team, or look at it as an organization as a whole. Our care teams are supported by all this information and all this data. And so we're able to really provide a whole person view of what's going on with that individual. We're able to utilize the whole population of patients and really figure out what are some of the best practices around how do we treat that population of patients, and then transfer that learning that we have from that whole population to that individual patient's care.
The patient walks in the door and the patient has a visit and sees multiple team members, and the multiple team members are in the electronic health record documenting information about this patient. All this information is then stored into tables in NextGen, which is the name of our electronic health record. That information in the tables can then be extracted by our IT department into something we call a business intelligence tool. And they are able to extract that data and actually put it into different tables that are more meaningful for our clinical and operations uses.
We're really focused on health outcomes in this organization, and so each care team has a bulletin board where we hang our measures and actually the graphs of how we're doing related to the things that we're working on and that we have said in the organization are important to us, such as A1C outcomes, continuity outcomes, smoking status outcomes, and then it provides an environment for the staff to be able to have discussions about how they're doing as a team.
I look at the data wall on the pods all the time, and it's a critical part of us assessing and reassessing how we're doing.
We post certain outcomes for diabetes, we post outcomes on continuity, we post outcomes on certain PDSA projects we're working on that allow staff to look at how their team is doing compared to the rest of their site and as well as the rest of the organization. And also creates a little friendly competition among staff to improve their outcomes.
Whatever's on our data board and what we're looking at and what we choose to review at weekly managers meetings are the things that are going to get better. We're talking about it. We're problem solving together. We're figuring out how to change that scenario so that more patients are getting good care.
The provider-to-provider comparison is really important to figure out, is there something that a certain provider is doing that's better than another provider, and are they having different outcomes, and is there a best practice that we really need to focus on? There's a specific way of doing something that is impacting the outcomes and the health of our population of patients.
Without data, we don't know how we are doing. We don't understand, is the care we're providing, is it making a difference?
We can see some of their hospital information when the patient actually goes to the hospital, so we have a better picture of what actually happened to the patient when they were in the hospital. So we're not again relying on either the patient telling us or us trying to figure out after the fact what actually happened. Where in the past, we wouldn't have that knowledge, and a lot of times a provider would actually run those tests again to try to figure out what is going on with the patient.
With paper charts, your ability to get information on every single patient in a population is nearly impossible. So when we were trying to extract data from paper charts, we usually just did a sample of charts of patients in that population. So you were only maybe looking at 10, 15, 25% of patients in that population, which you can get an idea of how you're doing, but you have no idea how you're doing on your entire population. Data actually does bring a lot of awareness to providers when they think they're doing really well with a specific measure for a patient population, and they get their data results and they realize they're not doing as well as they thought. And just awareness can help that provider make different decisions when they're in the exam room with these patients.
If I see that the numbers have gone worse, then I'm going to do everything in my power to make them better. They're public and they're right out there. Conversely, when they're awesome, yeah, we as a team, we're going to celebrate in our successes together.
Patient activation is a term that refers to getting your patients involved and participating in their health care. It's a big part of the group visit concept here at Clinica.
We care for the patient about 0.1% of the time, and the patient cares for the patient about 99% of the time. So what we really needed to do was to be better at helping patients move forward, and that patient activation piece is really key for us.
It's a pretty great moment to share with a patient, well, you set this goal, last month, and how are you doing with that? And they've, report back to you what they've done and if they've sort of made the goal that they set. I mean, there's, it's very exciting. It's like winning a soccer game or whatever. They develop a lot of confidence. And I think it also feeds into the strength of the doctor-patient relationship, that we negotiated this together, they achieved their goal, I celebrate it with them, and that, we strengthens our team.
We have lots of studies that show that if you hear from someone that you trust that you should stop smoking, that the quit smoking rates are higher than if you hear that in any other message on the bus, over the radio, or in any other setting. It is that relationship that actually helps activate the patient.
There's something very empowering about giving that data first to the patient, and they can chart it in their own, what we call shadow charts, before it's entered into the electronic health record, or maybe it's entered simultaneously in the electronic health record by their nurse or medical assistant. But this patient now has an understanding of what their blood pressure actually is, and they're writing it down. They're not just being told what their blood pressure is.
It's wonderful to be part of a team with patients and to see them gain knowledge and confidence and be excited about their health and motivated to make change. I mean, I can sit all day and talk to someone about why it would be good to eat different foods or exercise more. But when they come to me to a visit and say, hey, I did this and this happened and I feel really good about it, that will take them so much farther than anything I say.
Transitioning towards a medical home is a process over time where we have to continue to move in small steps, small test of cycles of change towards a concept of being more patient-centered.
I think the satisfaction of our patients have increased tremendously. The health of our patients, I think even our staff, providers, everybody, even the nurses, for me, it has totally changed everything.
We were thrilled to achieve patient-centered medical home status, and it's an NCQA recognition. And in this clinic, with our medical homes accreditation, when we have this team-centered approach, we have shown that we have better quality outcomes.
Patient-centered medical home is an incredibly important concept, and it really, it's the future of where healthcare needs to be. And I'm really glad that we're, showing the way at Clinica.